I'm Hanin Khundukar. Today we're gonna talk about disorder of consciousness. Let's define the conscious is fully alert, fully awake, oriented, and responsive to the environment. The system response for the conscious is the brain, the both cerebral hemisphere that's affecting to awareness and the brainstem for wakeful, especially by reticular activation system. Any problem that's affecting reticular activation system that lead to the coma, that means loss of conscious, loss to react to the environment, loss for awareness, awake, unoriented to the environment. The affecting of the reticular activation system that caused by the structural causes or diffuse. The structural causes defined by the infratentorial or supratentorial. The infratentorial that affecting the brainstem or the cerebral nerve itself. The supratentorial is by affecting the cerebral, يعني that affect the cerebral hemisphere, lead to compression of the brainstem that lead to the affecting the reticular activation system. But in the diffuse causes, we have the oxygen hypoxia or metabolic causes like decreasing sodium, glucose, or even epilepsy or inflammatory causes like encephalitis, meningitis, and drug intoxication. We think about alcohol or opioids or antidepressant drug. Okay, when we alert having a patient with alert of level of conscious, we should check about taking a history and examine patient by doing the Glasgow Coma scale and examination and do blood work and imaging like CT, MRI, and do EEG for the patient. Then the patient how to manage in ER. We when we manage, we do as we do in the emergency department, check the airway, breathing, and circulation, and having Glasgow Coma scale, check the eye opening and verbal response, motor response, and give it the patient's score. But the most important point to different the cause is a structure or metabolic, we should do the examination by the neurological examination if there is hemiplegia. If the hemiplegia is ipsilateral in the cranial nerve and contralateral of the body hemiplegia is infratentorial or supratentorial in the opposite. But when do the examination and see the flapping tremor, we think about the hepatic encephalopathy, that neurotoxic by ammonia, and check for midbrain to the pupil. The pupil, is it normal? There is metabolic cause, but if there is not normal or asymmetry, that may in the supratentorial, that compression of the parasympathetic in the third nerve palsy lead, and also examining for corneal reflex, is it affecting in supratentorial or structural causes especially, and makeup labs. If there is a blood profile is normal, there is a structural causes, but there is abnormal for hypoglycaemia, hyponatremia, or hypernatremia, or increasing in the ammonia or urea, that may metabolic causes. And do EEG. When we do EEG, if there is hepatic encephalopathy, there is triphasic wave in EEG. If this patient have herpes simplex encephalitis, we see sharp wave in the temporal lobe and increasing beta activity over in the overdose of the diazepam. And also do lumbar puncture if it's a meningitis or encephalitis to detect the cause of it, and do CT or MRI. Normal, it's normal in metabolic causes, but there is supra or infratentorial structure, there is asymmetrical finding, or there's lesion or hemorrhage in the this image. After detect the cause, we should treat underline the causes. If there is hypoglycemia, give the patients dextrose. If there is overdose, give antidote for naloxone or benzodiazepine, or give the patient having alcoholic, give them thiamine, after that giving dextrose. The prognosis in the metabolic causes is good prognosis, but in the supratentorial is better than infratentorial, is a very bad prognosis. The bad prognosis is brain death, is irreversible cessation of all cerebral and brainstem function with preserve of the cardiac activity. When we talk about brain death and death, we can differentiate by the cessation of all function is the death, but cessation of all function except the cardiac activity is the brain death. In the time we can organ take for donation. The brain death we can diagnose by criteria. The most there is two main elements: a deep coma and brainstem damage. And we have also vegetating state and lock-in syndrome is fully aware and conscious, but no motor or paralyzed of the head to toe. There is, as we say, there is activity in the cerebral, but is no active in the motor area of fibers. Just can move the eyes. Okay, as the home message, the approach to the comatose patient detect the causes is structural causes, infra or supratentorial lesion, or the metabolic lesion. The 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 fundamental signs, if three of them, is there is a flapping tremor, it is the pupil asymmetrical or asymmetrical finding in neurological examination. And thank you for everyone to listening me.